So you've decided to undergo the DRX 9000 treatment protocol with us at Chase Clinic. Thanks for being a patient. There are a few things you should know and that will help you understand what the treatment is and what you should do and what you should not do during the treatment. Basically what to expect. So as we probably discussed before, we focus on one disc at a time and we focus the traction on that disc. So we traction, full traction for a full minute, half traction for a half minute, and we do that for a half an hour at each session. That will gradually pull the herniation back into the disc, and it will also pull fluids back into the disc so the fibers around the disc repair, then it holds it together. So when you stand up, it doesn't squash down and bulge out. That's how it works. So what you want to do during the treatment is avoid compression. You want to get the maximum benefit out of the treatment. So don't do things that compress your back while we're treating. So if you run, heel strike. That compresses your back. I recommend no running until Dr. Leahy or Dr. Steven tell you it's okay. Carrying weight. I recommend nothing heavier than 20 to 25 pounds in your hands. Because if you have 25 pounds in your hands, that's weight on your back. The other thing is try to move around a bit. So if you're working on a computer, don't stay still, lean forward for hours at a time. Get up, move around, pull one knee up to the chest at a time, rotate and stretch, get your back moving, okay? Now, in terms of exercise, we're going to work with you on that. Basically, you shouldn't do a whole lot until 2 to 4 weeks in the treatment. If you have questions about that, ask us. Swimming is generally okay. Flip terms can be hard on some patients. Lifting weights, it really depends. If you're on your back doing a bench press, there's no weight on your spine. That's fine. If you're pulling down on a weight machine, that's okay. That's actually decompressing your spine. But if you're pushing up, no. Again, any questions, ask us. We need to make sure you know exactly what to do, and we can't cover everything on this video. Now, in terms of what's going to happen, everyone wants to know, okay, when do I feel better? And that's really important to know. I wish I could tell you right away. Some people get a lot better after the first or second treatment. Some people not till 6 or 8, maybe even 10 weeks later if we have to go extra. It's impossible to tell. I will say the average patient is significantly better after about 3 weeks, 3 to 4. That's the average, but it could be anywhere in there. So hang in there. A number of people get relief at the end, and if you're one of those people, you just have to hang in there and stay with us until we complete the program. If you have multiple discs involved and there's a lot of compression or herniation, so multiple discs are a factor, it's going to take longer. If you have 3 discs, it's not going to take 3 times as long, but it might take as much as twice as long. We've gone over the MRI with you. We've decided you're a good patient to start this. So the success rate is somewhere around 90%. We haven't done a full-fledged controlled study, so we can't say that for sure, but that's what we've seen. So the success rate is much better than surgery, much better than any other treatment. You may need to have your spine adjusted periodically, but for this treatment protocol, it's not the major source of treatment. So we're going to keep talking with you and ask you about your symptoms as you go along. If we decide you need an adjustment, we'll do that. And if we do decide that, you'll notice the results with that right away.